IUD, or intrauterine device, is a long-acting reversible contraceptive method. An IUD is a tiny T-shaped plastic or copper device that is inserted into the uterus. There are two main types of IUDs, one made of copper and one made of plastic. The copper T380A, or Paragard, is made of polyethylene. The stem of the T is wrapped with fine copper wire. The Paragard can be left in place for 10 years. The other type is Mirena, a hormone-releasing IUD. It is made of polymer plastic and has a hollow stem containing progestin, which is continually being released. It can be left in for 5 years, although some data show it can be left in for up to 7 years. Mirena prevents ovulation and thickens cervical mucus. Both types alter the lining of the uterus. IUDs are the most inexpensive, long-term, and reversible form of birth control. They must be inserted and removed by a trained practitioner. 99% effective with perfect use, 98% effective with typical use. The common misbelief about IUDs is that it is a device or substance that causes an abortion. However, IUDs prevent pregnancy by preventing fertilization. The IUD prevents sperm from fertilizing ova. Once an IUD is placed inside the uterus, it requires no care. An IUD may come out of place and have to be reinserted by your doctor. IUDs do not disrupt the spontaneity of sexual intercourse. Once it is in, it's in. You may go about your business as usual and not have to worry about remembering to take a pill or having to stop mid-coitus because you forgot to use a condom. IUDs are generally geared towards women who do not plan on getting pregnant for a few years. However, once an IUD is removed, there should be no issues with getting pregnant if a woman chooses to. Also, IUDs should be used when a woman is in a faithful and long-term relationship, since the IUD does not provide any protection from STDs. Insertion may be uncomfortable and even painful for some women. Following insertion, there may be heavy cramping. Menstrual flows usually increase significantly, but may decrease after 3 to 6 months depending on the type of IUD used. IUDs are convenient, effective, and inexpensive. Fertility rebounds quickly upon discontinuation. There is a low risk for side effects. Studies have shown that IUDs may provide protection against ectopic pregnancies, and they are an excellent alternative for women who cannot use oral contraceptives for certain medical disorders. IUDs are a great method of birth control for anyone who doesn't have the time or money to worry about getting pregnant. There is virtually no need for care once it is inserted. You do not have to worry about doing anything right before, during, or after sex, and it is virtually cost-free after the initial insertion. For more detailed information, contact your physician or consult an accredited online source.